Hello, I am Samarendra Mohanty. I am co-founder and president of Nanoscope Therapeutics.
Please tell me about the work you're doing and present it on for the treatment of AMD.
With exciting data that we are getting in retinal degenerative disease by use of MCO10, which is multi-characteristic opsin, applicable in a gene agnostic manner. We are advancing our follow-up program on age-related macular degeneration, advanced stage patients with geographic atrophy to restore vision in the atrophic areas. In this approach, we are using multi-characteristic opsin, but it's a capsid-free plasmid which is being delivered in a targeted manner using laser to the GA areas. So we are finalizing the IND enabling studies, and by the end of year we plan to submit IND.
Are you having favorable outcomes in your preliminary trials?
Yes, so as I said, the MCO has been shown to be successful not only in preclinical model but in retinal degenerative disease like our human trials. So here in a preclinical model we have developed a model of GA using laser injury of the outer retina, and then very low power infrared laser is used to deliver the plasmid, and it has yielded efficacious result which is long lasting efficacious results. So based on which we are now initiating the GLP tox study in the NHPs, and as soon as it finishes by end of the year we plan to submit the IND.
So this treatment is for people in later stage with geographic atrophy?
So this trial will be primarily on the later stage of macular degeneration, whether there is a significant loss or atrophic site. As you know, there is approved therapies coming up to slow down the progression of disease, but there are significant amount of patients who have a significant loss or macular atrophy. So our trial will be primarily focusing those patients with unmet need. So our first in human application will be primarily for geographic atrophy. Later it can be disciform scar or anything which lead to photoreceptor degeneration in macula. It will be applicable. We have some good safety efficacious result in macular degeneration patients in Stargardt macular degeneration in our phase 2 open label trial, but that was using a AAV2 vector with intravitreal injection. And now we are planning to, excited by the data, with a laser delivery to the targeted macula, we believe we can increase the transfection more and have efficacious outcome.
So this treatment can repair atrophy in the macula and retina. Can it restore vision to those areas?
What we have seen in Stargardt macular degeneration patients, that there is a enhancement in visual acuity with MCO sensitization, but here we believe that will be our main efficacy endpoint to measure with ETDRS later and having visual acuity gains.
What are your next steps? Are you preparing for a new clinical trial?
Yes, so basically we will be submitting IND, and with FDA's input we will finalize the protocol, and then we can start the clinical trial.
How can a person find out more information or get involved in this clinical trial?
Yeah, the clinical trial, once its protocol is finalized, and it will be posted in clinicaltrial.gov after IND is open, and then we'll ask everyone to follow us on LinkedIn or in our website, so where we'll provide more information and the link to the clinicaltrial.gov site, and then there will be inclusion and exclusion criteria. Based on that, the patients can be enrolled.
What are some of the requirements to be eligible for this trial?
Yeah, since it's a fast in human and a novel delivery using OCT guided laser delivery, so we want to go for patients having severe macular degeneration. In the sense, they should have significant atrophic sites where we will be delivering to improve the efficacy with the goal of improving efficacy. So I think the limitation will be all defined in the inclusion-exclusion criteria.
Do you have any thoughts you'd like to conclude with?
I think it's very exciting time for optogenetics, and the results that we are seeing in RP and Stargardt macular degeneration, I think we are very encouraged by that, and we believe that there will be some similar benefit to macular degeneration patients.
Thank you so much for your time today. We look forward to following your progress.